give you was positive for capsular polysaccharide antigen. Then you have to make a diagnosis from micro plus medicine that it is a case of cryptococcal meningitis. And then what is the next best step? And then you have to answer it as amphotericin B. So it is actually we're reaching the same point, but the job has become much more tedious now because it is much more clinical. So I just joke in my offline classes that nowadays those 200 MCQs will feel like you are not solving 200 MCQs, rather you are treating 200 patients in an OPD or a ward. So that is the scenario which has become, and the MCQs they have become much more practical. Though 10 to 20% of MCQs we still get, which are direct ones, which are based on rote learning, but we have to change our way. A lot of students are nowadays doing that. They study system wise, right? Also, you take a CVS of like physiology, then pharma, patho, medicine. So that is one way of tackling this, which you can do. A lot of students do this even from past many years.
So at this point, besides a clinical and theoretical integration, there is also an inter-subject integration. People are supposed to study pharmacology in tandem with anatomy, physiology, and pediatrics and other branches. So they have to have a wholesome knowledge about the subject. But when it comes to the subject of pharmacology, it is vast. So it is not easy at this point to prepare the whole of the subject for such competitive exams. So it's also imperative that we rush to the seniors, we get the PYQs, we get the 10 years papers, and that's how students are used to studying. So if you could guide us on how to best make use of the PYQs in the subject of pharmacology.
See, if you want to master pharma, I mean, PYQs are one thing is that PYQ, they give you PYTs. So it's not actually about the PYQs. Yeah, they give a sense of how the MCQs have been asked in the past. But what you need to understand from those PYQs is the PYTs. Previous year's topics are important. So remember, the questions are not repeated, but the topics are repeated. Almost 90% of the topics are repeated from the last 10 to 15 years. Now, says ma'am was asking about, what can I do from pharma as a volatile subject? What can I do? In fact, this is something which I used to do as a student and advise to each and every student. You have to do this not only for pharma, but three subjects which are very volatile from the preclinical aspect: pharma, micro, and biochemistry. Now, all of you would agree that these three subjects are highly volatile. Means today you study these subjects, and after 1 month, you look back at the notes and you're confused that have you ever read your notes or not, right? So what is to be done is, number one, don't go for a bolus study for pharma, micro, and biochemistry. Bolus, what I mean is, let us suppose I have decided to give 50 hours to pharma, right? 50 hours, I need to revise pharma. So one way I can do is, suppose I'm studying 10 hours a day. So I'll study 5 days and 10 hours a day, 50 hours. So in 5 days, I'll try to complete pharma. Now that way, you'll never ever be able to retain anything, right? So I should not go for bolus. Maximum amount of time I should study every day for pharma, micro, biochemistry is only 2 hours, right? So rather than studying in 5 days, I'll stretch it out to 25 days, multiplied by 2 hours per day, and that becomes 50 hours. Now, there is a certain way to master the volatile subject so that even before the exam, when you look at your notes, you still will find that you remember a lot of things. Now, how to go about that? See, it's called as RRR formula: read, revise, re-revise, right? So how does it work? Let us suppose I study something for 2 hours today. Tomorrow, towards the end of the day, I will revise whatever I've studied today for 20 minutes. I'll revise. The next day, I'll read something new. Then I'll revise 20 minutes, whatever I've studied yesterday. 10 minutes, I'll overlook briefly, quickly, whatever I've studied day before yesterday. So 2 hours, 20 minutes, 10 minutes. Read, revise, re-revise. So essentially what you're doing is, you're not only reading and revising, you are revising and re-revising. So 3 times I'm revising and simultaneously. And what this does is, you will see at the end of the day, when after 25 days, after giving 2.5 hours every day, you will see there is a you know, a virtual image of your notes is going to be created in your brain. And actually, if you close your eyes, you can flip through the pages in your mind. Now, to reach that stage, you need time. And gradually, you have to cover it up.
Sir, as a teacher, what is your message to the students? Because again, we come back to the subject of pharmacology as a whole. It's a vast subject. They are to revise a lot of things, and plus the latest guidelines keep coming in. So it's also important to stay updated with the latest guidelines of WHO, whatever pharmacology bodies there are for the latest guidelines. So they have to stay updated that ways also. So a particular strategy to keep revising the what is given in the theory books, and plus also staying updated with what is practical.
See, being updated, I mean, see, one of the most important part of pharma as such is the new drugs which they ask. But again, let me give a disclaimer here that the new drugs are important only for INI set. They're not important for NEET PG. They do not ask much about the new drugs. So if you're specifically preparing for the INI set exam, I mean, you guys must be following me or any other teacher on Instagram, pharmacology teacher. So all of us, we do put updates on the new drugs. So what you need to do is just, add those new drugs to the respective section. For example, let me tell you about a new drug I have posted on Instagram, and the drug is called as atripamil. So atripamil is a non-DHP calcium channel blocker which blocks AV node, and it is given by intranasal route for treatment of an acute attack of PSVT, right? Intranasal for self-treatment. So whatever source resource you are following, you can just go into your notes and to the calcium channel blockers in antiarrhythmic drugs where we use only diltiazem and verapamil. You add another drug, atripamil, right? So by doing this, what will happen is you'll automatically update your notes so that you don't have to read separately the new drugs. You'll read them in context of how they fit in with respect to the already existing drugs in that particular topic, right? So new drugs, that is where you can get from. You can go to my Insta or any teacher's Instagram, and you can find all the new drugs I've given. And before NICET, 1 month before NICET, I'll be posting all the new drugs approved by FDA in the last 2 years on Instagram, which are important as well. Otherwise, updates as such are not very important for NEET PG exam. So NEET PG, you need to do the basics right, and you'll get a very good rank.
Okay, so this is important for everybody to note that as per Sir, NEET PG, you do not need so much of the latest of the drugs and everything. They do ask it in INICET, but not in the NEET PG as such. So we have already questions coming in from your students, and people are asking about that they have doubts on spurious drugs.
Yeah, I mean, see, spurious drugs is a controversial topic, and I have told again, time and again. So if there is a 500 milligrams paracetamol tablet, and if it has 200 milligrams or 250 milligrams, then it is not a misbranded drug. It is a spurious drug because it does not have adequate amount of drug in it. That is, so spurious drug is a drug which will not produce the desired effect, whatever it is supposed to produce, right? So if 500 mg paracetamol has only 200, it will not produce the desired effect. A misbranded drug is somewhere where the labeling is wrong. For example, let us say the name of the drug is misspelled, or the schedule H or G is missing, or let us say the expiry date is missing or wrong. So this would be called as misbranded drug, right? So don't stress too much. You'll find some MCQs which are controversial, answer different in different places, and there is nothing to worry about that. This 1 or 2 MCQs here and there, it's okay, it's fine.
So when we talk about some topics which are extremely confusing, for example, just the one that you guided us on, could you please elaborate on certain confusing topics, ambiguous, where students get confused on the ambiguity of the topics. So
Okay.
that has to be prepared well.
Yeah. So I always, even I've posted this on Instagram as well, time and again, that whenever a lot of students, they ask me, sir, what do you think? From which topic or which drug MCQs are more commonly asked? Right. So I ask them back, what do you think? I'm sorry. I asked them back, what do you think? MCQs would be more commonly asked from which drugs? The drug which are more commonly used or less commonly used, right? So you get the gist of it. So I'll just hang on, I'll give you a simple example. For example, let us talk about CVS, cardiovascular system. Let me talk about arrhythmia, right? So arrhythmia, the two drugs that are most commonly used in emergency, one is lidocaine, one is amiodarone. So majority of MCQs will find from these two drugs. Congestive heart failure, majority of the MCQs would be asked from digoxin, right? Digoxin or the drugs that decrease mortality. If I say antihypertensive drug, which are the two first line drugs we prefer, one is ACE inhibitors, ARBs, and second one is calcium channel blockers. So most of the MCQs would be from these two classes of drugs, right? If I say anti-epileptics, CNS, anti-epileptics will find MCQs from the most commonly used drugs in government hospitals, which is phenytoin, carbamazepine, valproate. These three are most commonly asked. I'm not saying others cannot be asked. Anything can be asked, but this is what I would put my money on, my right. And similarly, like antipsychotics, whenever they ask an MCQ, the antipsychotics, the most commonly asked antipsychotic is clozapine because it is hell of a drug, it's a good drug. And the MCQs are on extrapyramidal side effects, which one causes more or less. Antidepressants, the MCQs are mostly on SSRI or mirtazapine-like drug. So likewise, like if I go to respiratory system, you'll see a lot of MCQs you'll find from theophylline, right? GID, you'll find MCQ from the PPI, proton pump inhibitors or sucralfate. So there's another reason why we do PYQs. So once you solve 10 years of PYQs, you'll get an idea of which topic is being asked repeatedly, right? So that is where we need to focus. But apart from that, let me tell you one more thing. Again, I tell this in my offline classes as well to students that they should prepare a list of drug of choice. So as you should do this today itself, right? I'm not saying make it in one day. You can take 2, 3, 4, 5 days. And as you revise your pharmacology notes, you'll come across different drugs, right? Like let us suppose you come across doxycycline. So doxycycline is drug of choice for this. So keep writing all the drug of choice separately and the antidotes of choice, right? So after you revise your notes, you might be having some 8 to 10 pages maximum of the drug of choice and antidotes of choice. And now by doing this, what am I trying to do is, a lot of students ask, sir, I'm done with pharma, but I have this fear that I'll forget it. So right, so I cannot obviously revise pharma every day, but there's something I can do. What can I do? Is before I go to sleep, make it a routine. Make it a routine. Before you go to sleep, revise 5 drugs of choice that you have written in the 8 to 10 pages. So revise 5 drugs of choice, and then ask yourself by placing your hand on the drugs of choice of yesterday, day before yesterday, do you remember them? Try to actively recall, right? So keep doing it, like read, revise, only the drugs of choice. So by doing this, what would happen? You'll see just in a month's time, every drug of choice would be on your tips, right? And then what would happen is whenever you go back to your notes and revise your notes, you will see you already know half of the most important stuffs. Pharmacology, 50% is drug of choice. If I do that, my job is done. So see, competitive exams are, it's about knowledge and IQ and etc. everything, but it is also about 50% is about knowledge, IQ and all. 50% it is about strategy and execution and planning. How do you plan it? So you plan this way that I've told you about pharma, it will never bother you guys.
So now there are other questions also. For example, people are asking what should be the difference between the strategies that you follow for NEET PG and the strategies that should be followed for FMGE exam.
Well, see, NEET PG, FMG exams, these are all different exams altogether. And you know that NEET PG, FMG, the basic difference is one is a qualifying exam, one is a rank-based exam. And we don't have negative marking in FMG exam. So FMG exam, the first thing you guys need to remember is you don't have to leave any MCQ. There are 300 MCQs, you have to solve all 300. Leaving even one MCQ is a crime in the FMG exam. NEET PG, we do have to leave 10, 20 MCQs depending upon whatever is the level of the paper. Right, now, if you're an FMG aspirant and you're preparing pharmacology, and then there is a little bit different take. So in NEET PG, I should know everything about everything. That is one thing, right? In FMG, I should know something about everything. And the level of the paper of FMG nowadays is like NEET PG. But since in FMG, I'm not competing with anybody, I'm competing with myself. I have to outdo myself and get more than 150 plus marks, right? So in FMG exam, even if you are not good at pharma, let us suppose you are not good at pharma, you are very bad at pharma, and a lot of students do this, that okay, I'm not good at pharma, I'll leave pharma. Don't do that. In FMG, if you're not able to do the complete subject, you can do at least something. For example, as I said, at least do the drug of choice in pharmacology, at least do the drugs of choice, and at least do the side effects and mechanism of action of some important drugs. If you can do the bare minimum, then also it is good for FMG exam. Because see, we have 19 subjects, and you cannot be rock solid in all 19 subjects, right? In NEET PG, you have to be. But in FMG, out of those 19, if my 14 to 15 subjects are good, and 3 4 subjects if I'm not very good at, and if I try to do something, like for example, I can do the revision videos. So in FMG exam, for those, I don't recommend revision videos for all 19 subjects. But let us say I have 19 subjects and 15 subjects are my good. I love those 15 subjects. 4 subjects, I don't know what to do with them. So for those 4 subjects, I can use the revision videos or a different strategy, right? Don't rely entirely on revision videos because they're very short. And if your base is not good from your MBBS time, you'll not be able to use the revision videos adequately. But yeah, as a patchwork, I can do this revision videos separately. So in short, if you're an FMG student and pharma is bothering you and you don't think you're able to do a lot, then just do one thing to begin with. Write down all the drug of choice in one place. That is one thing, right? Revise them. Second thing, what you can do as an FMG student is, let us say I'm an FMG student and pharma, micro, and biochemistry. These 3 are my weaker subjects. So I can use any app, make a custom module of 25 MCQs and solve them daily, right? So there is another way of going for it. And again, if you're weak in pharma, I have my book through CBS only called as Touch Pharmacology. Is hardly, I think, 22 pages. The entire pharma has been consolidated in 22 pages. If you like it, you can use it.
Thank you, sir. So, can I have the backend team please pop up the coupon code that we are offering to all our attendees today? We are offering a 40% flat off on One Touch Pharmacology, authored by Dr. Ranjan Patel. So, if you like it, please do pick it up. Redeem your code on our website www.cbspd.com, and you will have your book with you. So, sir, meanwhile, let's proceed to some other questions that students have asked. What approach do you recommend for solving tricky pharmacology-based clinical scenario questions?
See, clinical scenario questions, whenever they ask you, it is nowadays they ask you about the next best step, right? In a clinical scenario, whenever a patient comes to you, remember the treatment is not only about drug of choice. There are a lot of things we do. Like, let us say, for example, they ask you a case of PSVD, right? A patient of PSVD comes to us, and what is the next best step? So they'll give you the options like adenosine or a calcium channel block or a beta block. Plus, they'll give you carotid massage, right? So the moment we look at PSVD, we jump in onto adenosine, right? Adenosine. But if you know from medicine, the first thing we do is not adenosine. I mean, I'll ask the sister to prepare an injection of adenosine, but then at that time I'll be doing carotid massage to the patient, which will activate vagus nerve and block the AV node. So these are the things which you need to look at from medical point of view, medicine point of view. So here medicine comes in. So whenever you look at a disease, look at it from the medicine perspective, not only from pharma perspective. Otherwise, you'll be confused. Because as I said, nowadays the MCQs are not purely pharmac or micro or any preclinical subjects. They have some element from either medicine or pediatrics. Because at the end of the day, you'll be treating a patient, right? And you need a wholesome approach for the treatment, and it cannot be only drugs. So there are a lot of things we do. For example, let me give another example. They'll ask you, there is a patient of SIADH, and he comes to us. And what is the next best step in his management? And now one option they'll give you is conivaptan, right? Second option they'll give you free water restriction. Now conivaptan, all of you know, is used for treatment of SIDS, but it will not be the answer here. Because before giving conivaptan, I will try free water restriction. Now, why I'm trying free water restriction? The reason being, the main problem with SIDH is dilutional hyponatremia. That's because there is more water in the body. So I'll try to restrict water, and if that works, that is the best, even without giving drug. So you have to look at from the medicine point of view. All right. So if your medicine is good, then these type of clinical cases where they ask you about the next best step in management or the best step in management plus the different clinical scenarios will be able to answer. So your medicine must be strong, guys.
So that's why we come back to the competency-based CBME pattern, the latest pattern where a vertical integration as well as a horizontal integration between the subjects has been, laid down for the students. So you have to have a grasp over all your subjects and not just, look at things from one particular angle. So
Yeah.
now we coming back to, because you've just told us that the students should be making notes of the drug of choice and everything. How far are flashcards important and helpful with such kind of preparations?
See, again, I mean, I am more of a kind of person. If you make the flashcards yourself, it is much more, productive. So I can give you a pre-written drug of choice list, right? I mean, in one Touch Pharma also I have a drug of choice list as well, but I don't advise to use that. I rather tell students to write it down yourself. So if you want to make a flashcard or let us say mind map or anything, and if you're creative enough to create something out of your notes, and then please go ahead. I mean, how can I say? It's all about strategy, how you make a strategy executed. So a lot of people will do just from the notes and they're fine about it. A lot of people they need something extra. But remember, whatever extra things you do, these small things, they matter a lot in NEET PG and INI set. And because even if you can score 1, 2 marks extra, because I'm telling you one thing, if you write down the drugs of choice in pharma separately, there is a chance that you will score at least one MCQ more in the exam. And you know that one MCQ more in the exam makes a lot of difference in your rank, 100, 200 up and down, right? So yeah, I mean, you can do those things as well.
So, okay, so because everybody's mind works in a different manner, somebody is more of a photographic memory, and they can just click it in their heads, and it gets etched in their brains, and they can reproduce in the exams. And some people are more of the writers and more of the thinkers who will write down everything and create their own notes and everything. So, first, it is important to also identify what is your brain pattern like, what is your memory like, and that's how you go forward with your own building your own strategy. So another question that is coming in is that in clinical practice, how do doctors manage drug interactions? It's difficult to remember which drug interactions are there, and particularly drug interactions involving cytochrome P450 enzymes. So that's another
Yeah, I
question
mean,
we have from one of your students.
yeah, I mean, see, there is a branch called as clinical pharmacology in the West. So if you go to US, Australia, New Zealand, Europe, uh, in the clinical bedside, there is a pharmacologist who accompanies the treating physician, the MD medicine guy, and it is the job of that clinical pharmacologist to rationalize whatever drugs the patient is on and see if the combination, the polypharmacy is good or not. Not only that, is not the MD medicine guy, rather the clinical pharmacologist is who decides at what doses a drug is to be given to a patient depending upon the particular drug. Like let us suppose vancomycin dosing, highly it is sensitive to creatinine clearance, the function of kidney. So based upon the creatinine clearance, and this is an MCQ that asked you in ionized at Martske nomogram, if you guys remember this. So it's a job of a clinical pharmacologist to draw a Martske nomogram and to find out that what dose of vancomycin should be given. Now, that is the luxury we have in the West. In India, it's up to the clinical physician how much knowledgeable he is or she is. और अगर मैं हिंदी में कहूँ तो हमारे देश में भगवान भरोसे चलता है, पता है आप लोगों को, right? So it's all up to you. I mean, it should not be like that, but you know that everything which is which is done in the West, everything is according to the protocol, right? In India, we cannot do that because we have such a huge population that if you follow protocols, then our healthcare will, just collapse. Like, let me give you a simple example. Like, do you know that in the West, uh, an ultrasound has to be done for 45 minutes. That is a minimum time you have to spend with each patient. And you know that if I do that in India, it is not possible. So an ultrasound that you go for in US or Australia, it will cost you around $1,000 or something. In India, for $1,000, you can buy your own ultrasound machine, right? And it's very cheap in India. So it's country specific. We have limited resources, and we need to learn how to survive in that limited resources. Yeah, obviously, what you can do nowadays is you can use a drug handbook to check about the different drug interactions, or you can use a very good platform is there called as Up to Date. So when you become a clinician, I strongly advise all of you, when you become a clinician, it is, I think, Walter Kluwer's Up to Date. Uh, Please take a subscription of Up to Date. As a clinical physician, it will help you a lot about drug interactions. It will help you a lot about the recent changes in drug use, because I myself use Up to Date, though I don't treat patients, but I use it so that I am updated regarding the treatment, etc., of different diseases. So, guys, it is something, the onus is on you as a clinician, right?
Sir, coming to conceptual clarity and mugging up of certain drugs and concepts and everything, how should a student balance these two aspects to prepare for certain exams?
Now, see, I mean, I'm more always inclined towards conceptual approach, because concepts are things we'll not forget, right? But if you'll cram up things, you'll forget. But now we have to make a balance out of both. And one strategy that I used while I was preparing is I used to paste a lot on the wall. So I would just use the sticky notes, write down whichever is volatile, and paste it on the wall. So by the time I was done with pharma, I had somewhere around 25 to 30 sticky notes in one part of the wall, and that was my go-to pharma revision. Those volatile parts, whenever I was free. I mean, see, suppose you'll not be studying, each and every second. So let us suppose I've taken a break for half an hour for a tea break. So in that half an hour, I'll have my tea. I'll just stand in front of that wall, those 25 to 30 sticky notes, and stare at them. Now, by doing this for around 6 months, what happened is whatever was the most difficult part in pharma for me to remember, it became the most easiest one. The reason being, when you keep on staring at one particular aspect time and again, what happens is it creates a mind map. I mean, that is what we call as mind map. So you can close your eyes and you can go to the sticky note number 1, 2, 3, 4, what was there. So again, I said, I mean, it's all about finding your weakness and finding a way to make your weakness as your strong point, and you can do that.
So coming to the next question from another student, in chemotherapy drugs, remembering which drug acts in which phase of the cycle is confusing. So what is an effective revision technique to remember these drugs?
Yeah, see, in the clinical subjects, they will teach you about in which cycle which drugs are given, and again, it's a difficult part to remember. And if you're not able to remember for NEET PG or INISET exam which cycle which drug is given, it is okay, fine. I told you time and again, you cannot be perfect, 100% perfect in everything, right? So again, if you have certain things in mind, like just you asked me, different cycles, and I'm not able to remember which anti-cancer drug is given in which particular cycle. So I'll just take a sticky note, write down all these drugs used in different cycles and paste it. And I'll not use my active time. Passively, I'll keep on revising whatever comes, every day, half an hour. So I can do that. And remember, you cannot do everything for the exam. You cannot be perfect in everything. Like, for example, you have asked me about anti-cancer drugs. A lot of students ask me, sir, anti-cancer drugs, I'm finding it difficult to get a hold of anti-cancer drugs. So what can I possibly do? Anti-cancer drugs, this is what I tell in offline classes, and this is what I teach in offline classes. Only the drug of choice and side effects, plus the antidotes for the side effects. If I know this much in anti-cancer drug, my job is done. I should not try to, study all entire anti-cancer drugs and die trying to do that. It's not required. So yeah, I mean, your preparation cannot be 100% perfect. It has to be near perfect. So don't be anxious if you're not able to remember some things. It's okay. Be easy on yourself.
So, all right, this is one teacher who makes pharmacology so simple for all of you. So, when I was, looking for experts from the field of pharmacology, I thought of you particularly because, I have seen your videos and I have seen how you teach pharmacology in your classes, and make the subject so simple. So, it's also important for all of us to follow one particular mentor and use the strategies that are being advised by this mentor. So Dr. Ranjan makes things so simple for everybody that we would recommend that all of you please follow him and his strategies to prepare for your competitive exams. So as a teacher, are there any gaps in the field of pharmacology that you have felt and you've covered in one touch?
Yeah, see, so One Touch was all about the strategy called as 20th notebook. There is something called as 20th notebook, which students make. They try to concise all the information. So if you go for my pharmacology notes, they are around 300, 400 pages. Right, but what I've done in One Touch is I've concised them into only 20 pages. You'll find the information which is 90% there, and 20 pages revising is not difficult. So this is something, if you're able to concise yourself, I would say do that, follow it up, do it yourself. If you're not able to concise, then you can go for One Touch and use it. And the very first time when I wrote the One Touch, I was keeping in mind that how much concise I can make it, as much as possible concise, right? So there is a different story behind One Touch. One Touch was never supposed to be a book. It was supposed to be a workbook which I was writing at that time. And in One Touch series, the first book that came out was Pharma. And at that time, Bhupesh Arora was there in CBS, and I went to him, said that this is a book I want to bring out, and he was like, "Yeah, this book is only 20 pages, and how I can release a book with 20 pages only?" And he's a good friend of mine, so I told him that, okay, you release the book, and if it does not work out, I'll buy all the books. So I just joked with him, and he released the book, and rest is history. I mean, One Touch we have covered from each and every subject, and thanks a lot to the
So
students.
that's actually the crux of the subject of pharmacology. It's a vast subject and brought down to just the crisp aspects of it.
Yeah.
Sir, as a teacher, your message to the students, and meanwhile, if people have any other questions, you may please go on typing in. Okay, we have another question, sir. Before you please go on, I'll ask you this question: how to remember the dosage of all the drugs?
For NEET PG and NISET, you don't need to remember the doses. For NEET PG and NISET, I know where this question is coming from because I was a student myself, and I was always worried about, yeah, I'll go into clinical practice and I don't remember the doses. Now, remember, the day you'll begin your practice, you'll be prescribing the same drug at same doses to multiple patients, and you'll automatically remember those doses. So leave that part for your clinical life, and where you'll remember only doses of those drugs which are important for your life, for your practice. Everything else in pharma would become useless for you. I'm sorry to say that, but that is what is true about because everything that you learn, you're not going to use it. Let us suppose if you become an oncologist, mostly you'll be using anti-cancer drugs. But suppose you are a surgeon or a gynecologist, then mostly you'll not be dealing with anti-cancer drugs. So that's it, pretty much. I mean, about doses, you don't need to worry so much from NEET PG or NISET point of view.
So now that we've spoken about the dosage of drugs, every class of drugs also has a separate mechanism of action. So is there should they be working on learning the mechanisms of action of drugs for such exams?
Yeah, mechanism is important. Mechanism is important. Mechanism is important because see, the way I teach pharma, you can extrapolate everything from mechanism of action, the uses, the side effects, the contraindication. You can find everything from the mechanism. So if there is the top to bottom approach, which you can do in pharma. So mechanism is always important. Yes.
So once again, all of you, please go to the website. We've already flashed the coupon codes, and you can redeem those coupon codes on our website www.cbspd.com and pick up your copies for One Touch Pharmacology. Once again, you have to follow one mentor and follow his strategy. So we have Dr. Ranjan Patel here on the studio, and he's decoding pharmacology for you. So any other questions, please go on typing, and we'll take them up. Meanwhile, can I please have the backend team acquaint our readers with what is CBS? So this was a little story behind what is CBS Publishers and Distributors. After all of this, CBS dedicated to education, we are offering 40% off on One Touch Pharmacology. Please pick up your copies, redeem your coupon codes, and we will ask Sir to please give his final message to all the aspirants who are going to sit for NEET PG exam. Tentatively, the dates have been announced as the first week of August. So, Sir, please, your final message to all the aspirants as pharmacology teacher.
Okay, so see, my message is plain and simple. I mean, this is all your hard work, blood and sweat, and you have given it up until now. And these last months, they matter the most than anything else. You have to keep grinding, keep revising. Towards the end, it becomes even more difficult because time slips like sand through your hand, and time is lesser and lesser, and the course is not gonna decrease. So, anyways, you need to focus. You need to keep. And those who have started late preparing, don't lose your hope yet, because even if you started late, you still have time to get there. And remember, as I said earlier, you'll not be perfect in 19 subjects. You'll have some subjects where you're not good at. So like 3-4 subjects, if you're not good at, just make custom modules, MCQs, solve 25 daily. And you just need to patch up that whatever gaps you have in your preparation. So guys, all the best to all of you. And I remember always an honest preparation always yields at least something, right? So if you're honest, and nobody else can say if you're honest or not except you and you yourself. So God bless you all. Take care.
Thank you so much, sir. I'll wrap up this session with a very sweet message from one of your students. He's written, "My name is Abhijit. I attended your offline classes and I have been able to pass my FMGE exam. Thank you, Dr. Ranjan, sir." So that's how, you follow Dr. Ranjan, follow him everywhere and follow his strategies, and you are sure to be successful.
Thank you. Thanks, ma'am. Thanks a lot, ma'am.
Now, not just pharmacology, we have a lot of, we have around 19 books in this series of One Touch. And while we are offering 40% off on One Touch Pharmacology today for 24 hours, you can pick up your copies, go to the website, browse the section, and pick up as many books you want. And that's where a very sweet note, all the best to all of you. And we are wrapping up here.